This is Grace with Graceful Living. Today we have our third episode with Dr. Terrence Young. Do you snore? Turn over. Turn over.
Snoring for people has been an issue. What's happening to the person who is sleeping, who is not waking up, thinks that they are getting a good rest, but in actuality, after using a device called a high-resolution pulse oximeter, which monitors oxygen saturation and heart rate through the night, we've seen some really interesting things occurring, especially when people snore. Their oxygen saturation, it drops. And immediately the body responds by raising the heart rate. Many people who snore, their heart rates are jumping 20 plus points, all the while the person is sleeping thinking that they're getting good rest, but their body really is not resting, being stressed by constant high heart rate and decreased oxygenation.
So there's a new device on the market that you've been using and you've tried it yourself. Did you ever have a problem sleeping before?
Never.
Were you snoring as far as you know?
I was told that I would snore on occasion.
And so since you tried this device, do you feel more awake during the day?
Yes, after getting used to the device, which took about 2 weeks, I realized that when I woke up in the morning, I felt different. I felt more rested. Many of us don't really have a comparison. These all do the same thing, which is to advance the lower jaw forward a few millimeters, thereby allowing the tongue to be in a more forward position and allowing air to pass through the back of the mouth more easily without getting obstructed. So this device clips on to the top teeth and the bottom teeth, and so this model is of the lower jaw right here. So you can see this prevents the lower jaw from falling back, and by turning this knob, it actually advances the jaw forward. So the more forward you move, the greater the airway space in the back. What's interesting is that many people just need a few millimeters of forward motion. You don't necessarily have to crank your lower jaw all the way forward, and just a few millimeters can make all the difference in the world. The degree of severity varies, and so whenever we suspect someone with sleep apnea where they stop breathing, we immediately send them to their physician to get a formal sleep study done. And generally what's recommended for those type of situations is a CPAP machine to help them with breathing at night.
365 Days of Graceful Living does not sell this advice and will not be held liable for problems with the use of this device. Please consult an authorized dentist or doctor if you are interested in using this device. If you like this video, please give me a thumbs up and subscribe. Please go to graceinhawaii.com for more information.